along with Arista, Medigate and ForeScout and Awake, we'll be talking about ways to foster the health of a hospital's infrastructure in order to protect the quality of patient services. The network is the central nervous system for technology in the hospital, and it enables clinicians to deliver the care that they need. Without a secure and reliable hospitals cannot function, and they will grind to a halt. Today more than ever, we need to protect our infrastructure from not only malicious users and ransomware, but also from malfunctioning and non-compliant devices on the network. And now with connected real-time healthcare systems, the stakes are even greater. Protection begins with understanding the context of each and every user and device connected. Knowing who, what, when, where, and why their connectivity is there is absolutely critical. Not only does everything need to be properly identified and classified, but any baseline shift in their behavior needs to also be analyzed. All of this isn't a small undertaking. We can't overburden those around with tedious tasks and manual processes. We need to enable them with technology that matters most in new, effective, and safe formats for a secure delivery of care. The solution to these challenges can be highly sophisticated in leveraging both analytics and machine intelligence, but that can't make them convoluted. Operation must be simple. It must not be overly complicated, and the network itself, if it is overly complicated, the network itself is its own security risk. It's important to maintain a simple and compliant network with the proper tools for rapid incident response and mitigation. And solidifying all of these is a critical factor in how we foster this healthy hospital infrastructure. So to begin, let's start with the network foundation itself. Hospital CEOs don't necessarily have a reliable infrastructure as the top of mind, everyday, critical thing to make certain that their processes are continuing to run. A poor infrastructure can jeopardize everything from patient care to critical delivery of services to financials. Arista's cognitive approach to networking brings a combination of inference and real-time action built on the principles that we've learned from our cloud customers to provide availability, agility, and analytics to the broader healthcare infrastructure. Troubleshooting is no longer an exercise of finger pointing. With a cognitive network, we can actually serve the business by getting the right information to the right people at a critical time. Instead of unplanned outages and disruptive code upgrades, all of this can now be done non-disruptively with live patching. Arista has been embraced by large healthcare providers, including cancer centers as well as innovative clinical research organizations around the world. Our switches and software have been known for their superior quality and performance, and a single operating system allows for a simple management platform and a simple architecture that can span not only across the data center and the campus, but also out into public and private clouds. Some of our customers have been able to reduce provisioning times from days to mere minutes by leveraging the principles in that which we show, which is increasing their operational efficiency and also reducing their CapEx. Beyond this focus of quality and ease of use, there's a wealth of other factors that need to be considered. With security being top of mind, segmentation being both granular and scalable, and even in a mixed vendor environment is very critical. Application performance is another key driver. With Arista Cognitive Wi-Fi, we can identify critical traffic like EHR applications and prioritize those flows across the entire network. In a hospital, uptime is critical. The network can't be down because lives could literally be dependent upon it. So with high redundant topologies as well as hitless software upgrades, we can reduce that downtime and make sure that clinicians are capable of doing their job at all times. The Arista Cognitive Cloud Network ensures that clinicians have access to applications that the infrastructure depends on. It ensures that the hospital infrastructure management teams have the visibility and performance and security and focus to focus on better patient outcomes and operational efficiency. By having a secure, reliable, and high-performing network, your organization can focus more on telehealth or other innovations that improve patient services and overall business operations. Your organization is no longer stalled by legacy, non-agile network infrastructures that pose more risks than benefits. With that solid network infrastructure in place, let's now look into its assets. To properly secure your organization's assets and digital services, you must have comprehensive visibility across all clinical connected devices and even non-clinical assets. You need to know about every connected asset and have the ability to safely assess their performance without impending patient services. For that, Arista has partnered with Medigate, and we thank Medigate for being here to talk a little bit more about how they achieve this process.
Thanks so much, Andy, and you touched on visibility as being foundational there at the end of your presentation, and what occurred to me is really what is visibility? I know that if we talk to, for example, an IT professional, I'm going to get one answer. If we talk to a clinical engineer, yet another, a supply chain professional, yet another. And I think there's also a situational flavor that adds spice to the definition. If we just think about COVID over the last year, health systems have clearly learned, it's inarguable now, that a deep understanding of their available capacity to treat patients is essential. The number of care-critical assets that they have on hand, as an example, where they're located, their security posture, the network status of these devices, utilization and operating requirements. You can continue to go on. These are high-level categories under which there's a tremendous amount of data required, supporting data, in order to make things actionable. Here's a case where, let's say, this is not a case of less is more. This is a case of the more the better. And I think that we get to the punchline here is that what Medigate has done through integrations, through native capabilities, we have pulled together what's required, a common foundation that is as relevant to the information technology professional as it is to the clinical engineer and so on, based on the roles that we talked about. And we deliver that foundation in the form of a real-time, data-rich, dynamic, which is important, dynamically risk-scored inventory. Not a snapshot of the health system's landscape, but a moving picture that covers all connected assets of all types, enterprise-wide, notably including IOMT, medical devices, which is really Medigate's calling card here, and a big part of the reason why we're partnered so closely, because it's a tough area of discovery and profiling. Now, we can think in terms, again, of the use cases that come under those headings in those roles. Getting back to what is visibility, if I'm, for example, looking at an OS version-based vulnerability, I need to know what? I need to, at a bare minimum, understand what devices on my network are running this version of the operating system, as an example, and where are they located? You need that at a minimum. If you're looking at recalled devices, a recall management process, the data are a little bit different. For example, you need to know the serial numbers of the recalled devices, the lots, as an example. Again, you need to know location, right? You also would like to know, ideally, what the status of those devices are, because if they're in use, biomed professionals would want to put a high priority on getting them out of circulation first. So again, we're getting back to these definitions of visibility, and that common foundation, that moving picture is what's required, because once you have it, and you know that much about the device, and if you recall, I talked about operating requirements, you can do some really cool things, deliver additional automation. And what we have done very successfully with Forescout, and we think it's a highly significant and meaningful integration, is delivered a capability where, because we know as much as we do, we're able to go ahead offline and append the security policies which were appropriate for individual device classes, as an example, and deliver that information in addition to the device profiles directly to Forescout. And it's highly significant because we know the authorized types of connections. We know what the devices require, both from an internal and external network connectivity perspective, in order to perform their mission. So we're able to dynamically generate these baselines, provide, along with Forescout, the ability for the segmentation management team to, for example, tweak the rules supporting those policies and model their effectiveness for as long as necessary until they're comfortable and they feel as though they can implement in production. That's significant capability that is not magic, but supports now a reliable process which makes network segmentation possible in IoMT, IoT environments in healthcare. So with that, Stacy, I think there's a lot additional detail that you can share. Why don't you take it from there?
All right. Thanks, Tom. So, in addition to the rich intelligence on all connected devices that Tom touched on, a healthy hospital infrastructure must also apply that knowledge to continuously control who and what can access your network when and where. So Tom did touch on this, but it must also control what communications should exist among logical groups and dynamically adjust accordingly upon new device connections and profile changes. Enabling dynamic, context-aware network access control and segmentation based on clinical context afforded by the combination of Forescout and Medigate data is both a short and long-term game changer. Forescout provides centralized real-time asset intelligence and policy management for all connected devices enterprise-wide. Forescout intelligence is includes enhanced medical device insight automatically provided by Medigate to create and enforce tailored policies that leverage valuable clinical context. Again, Tom touched on this, but we'll dive into it a little more here. Forescout is like a hospital security guard, greeting all devices as they enter the network, determining who they are, where they need to be, and who they are, where they need to go, and make sure they go nowhere else. And are they following hospital rules? Forescout understands what each device is, who's using it, their role or group, such as, is it a doctor using it, a visitor? Is it a corporate device? Is it an iPhone, an infusion pump, imaging device, a security camera, you name it. And again, all the medical device information is greatly enriched by Medigate data, who can understand these devices in very rich detail. Forescout then can take this information and make sure that they are compliant in terms of device configurations. Are they in the right segment? Do they have the right network access control? So Forescout that can enforce what group talks to what group in terms of these segments. So it takes the device classification, it forms a business logic group, and it knows what group should be talking to what group to achieve its role. And then what Forescout can also do is take that group-based policies, and send them over to Arista to enforce at the network level. Continuing with analogies, Arista is like a lock on the door. So they're making sure that only authorized groups can open that door and nobody else. So for example, a hospital bed can only, a smart bed can only speak with the nurse's station and nowhere else. Forescout also continues to monitor all these devices to ensure that they are policy compliant and that communications are what they should be. Just as a diligent nurse will redirect a wandering patient found in a restricted area to his correct location, Forescout can take immediate action to correct that non-compliant or misguided behavior, to push devices to their correct segment or location. Forescout dynamically enforces the right access and segmentation policies when a new device joins the network, a device profile or its communications changes or becomes non-compliant, and when threats or malicious behavior are detected by the likes of Medigate or Arista Awake. In summary, Forescout centrally correlates enterprise-wide device intelligence and utilizes that intelligence to apply targeted policies that drive automated workflows to enforce network access control, segmentation, and device configuration compliance, and immediately contain and mitigate threats with context-aware actions that do not affect critical actions. Now I'll hand it back over to Arista Awake to talk about monitoring the network for threats.
Thanks, Stacey. A key component of the human's body to defense is its ability to detect and sense threats. Now, with Awake as part of the Arista portfolio, we now have the ability to detect malicious intent, whether originating from trusted insiders or external attackers. The Awake security platform monitors and analyzes the thousands of IT and IoT devices that are on today's modern hospital network. Like your body's defenses look for bacteria and viruses that are likely to cause harm, Awake uses artificial intelligence-driven approach to uncover the presence of adversaries by autonomously identifying behaviors that are the precursors for attacks ranging from ransomware to supply chain threats, as well as those specifically targeting medical devices. Now, Awake's Ava, our virtual security analyst, augments your existing security team by connecting the dots across time, the devices involved, and behaviors observed. Like your immune system, Ava focuses on identifying the underlying condition rather than individual symptoms. Your analysts avoid the manual and painstaking effort of triage and diagnosis based on individual and often meaningless alerts. Instead, Ava provides them with a decision support system that automatically uncovers the entire scope of an attack along with investigation and remediation options on a single screen. Awake Labs brings additional hard-to-find human expertise that can help you investigate and respond to potential breaches. This team of highly specialized individuals has decades of experience responding to some of the most consequential breaches, including the likes of ransomware, insider threat, and business email compromise attacks targeting healthcare organizations. Now, by monitoring the security of all the systems on the hospital networks, not just those with security agents pre-installed, Awake ensures the devices needed by your medical staff are available and operating correctly when needed. And by detecting threats early in their life cycle, security teams are able to mitigate the risk and impacts. To mitigate and contain these threats, we interoperate with partners like Forescout and Medigate. So to connect these dots, I'm going to hand it back to Andy.
Thank you, Ed. So as you can see, a healthy hospital infrastructure really, truly starts with a network foundation. But more importantly, that network foundation must be highly available and highly secure. It must be able to be adjusted, updated without impacting clinicians. But more importantly, it has to be extremely secure. And to do that, we need great levels of visibility. Not just visibility for users that would come onto the network, but specifically around medical devices that are being added to the network. And so because of that, we have this great partnership with both Forescout and Medigate that allow us to have this great wealth of visibility about what is happening inside of the network itself. And that then goes deeper to allow security devices to tell the Arista network how it needs to address those devices, what it needs to do, make certain that they can talk to certain things, but not others. Allowing the network to be both secure and compliant when it comes to patient health records. And then finally, the network is constantly evolving, and more importantly, the devices that are connecting to the network are constantly evolving. So not only do you need something that allows the right things on and keeps the right things off, but you definitely need to have something that's continuously watching the behavior of those devices that have been allowed on the network. Enter in Arista's Awake. Awake watches those things and allows us to not just make certain that access is controlled and segmented, but that if somehow a device changes its behavior, the appropriate people are then notified so that they then can mitigate that threat. So, with that, thank you all very much. I want to thank Forescout and Medigate for partnering with us in this venture, and helping us truly define what a healthy hospital infrastructure is supposed to be. Thank you.